Hello friends, welcome to LG Institute of Physiotherapy. Today we are going to learn about plyometric exercise or plyometric. So introduction, let's start with the introduction and definition. So what mean by the plyometric? It's a stretch shortening drills or stretch strengthening drills. And it employs the high velocity eccentric to concentric muscle loading, reflexive reaction and functional movement pattern. And it's a high intensity and high velocity exercise, and that's emphasize the development of muscular power and coordination. Next, the plyometric training is integrated into the advanced phase of rehabilitation as a mechanism to train the neuromuscular system to react quickly in order to prepare for activities that require rapid starting and stopping movements. Plyometric training is defined as a system of high velocity resistance training characterized by a rapid eccentric contraction during which the muscle elongates, immediately followed by a rapid reversal of movement with a resisted shortening contraction of the same muscle. And the rapid eccentric loading phase is stretch cycle, and the concentric phase is the shortening cycle. The period of the time between the stretch and shortening cycle is known as the amortization phase, and it is important that the amortization phase is kept very brief by a rapid reversal of movements to capitalize on the increased tension in the muscles. Let's start with the neurological and biomechanical influences of plyometric. So, plyometric training is thought to utilize the series elastic properties of soft tissues and the stretch reflex of the neuromuscular unit. And the stretch shortening cycle is thought to stimulate the proprioceptors of muscles, tendons, ligaments, and joints, and it can increase the excitability of the neuromuscular receptors and to improve the reactivity of neuromuscular system. And this reactive neuromuscular training has also been used to describe this approach to exercise. Effects of plyometric training. So, effects of plyometric training is somewhat limited, but it is associated with an increase in muscles' ability to resist stretch, which may enhance the muscle's dynamic resistance capability. And evidence shows that it can also decrease the incidence of lower extremity injury. Application and progression of plyometric training. So, plyometric training is appropriate only in the later stage of rehabilitation of active individuals who must achieve a high level of physical performance in specific high demand activities. Preparation for plyometric, a patient should have, means therapist, we should check for the adequate base of muscle strength, then endurance and flexibility of the muscles to be exercised. And criteria to the begin plyometric training usually include the 80 to 85% level of strength and 90 to 95% of range of motion. Specificity of training, that means the therapist should design the exercise program that should mimic the function. Plyometric drill should be a design with the specific functional activities in mind and should include the movement pattern that replicate the desired activity. Progression of this plyometric, so we can increase the speed of drills. So drill should be performed rapidly but safely. So it emphasize should be placed on decreasing the reversal time from an eccentric to a concentric contraction, and this trains the muscle to generate tension in shortest time possible. A jumping activity is performed. For example, the progression of the plyometric activity should center on reducing the time on the ground between each jump. Intensity, so intensity, that means the increase the intensity applied, but it uh, it not enough to slow down, it should not slow down the activity which we are performing. Intensity also involves the progressing from simple to complex movement. Repetition and frequency, so repetition, increase the number of repetition of an activity so long as proper form is maintained, means technique is maintained or body posture is maintained during the exercise. Increase the number of plyometric exercise in a session, or increase the number of plyometric session in week. Contraindication: inflammation, pain, and significant joint instability if present. Plyometric, here we have the example of the plyometric activities for upper and lower extremity. So for upper extremity, catching and throwing the weighted balls and stretch, shortening drills, then dribbling a ball on floor or against the wall, drop push-ups, clap push-ups. Then lower extremity, the repetitive jumping, vertical jumps, multiple jumps, box jumping, side to side jumps, jumping or objects on the floor, hopping activities, depth jumps. And here you can see the picture in that the person is performing the box jump from floor to on a box. That's the plyometric exercise for lower extremity. And what precautions should be taken during the plyometric exercise? So high stress, shock absorbing activity are not permissible, so do not include the high impact heavy load activities for children or elderly patients. Be sure the patient has adequate flexibility and strength before the initiating plyometric exercise. Wear shoes, then always warm up prior to the plyometric exercise. During jumping activities, emphasize learning techniques for a safe landing before progressing to rebounding. Progress repetition of an exercise before increasing the level of resistance. Allow adequate time for recovery with 48 to 72 hours. Stop an exercise if patient can no longer perform. And the sample plyometric sequence for the upper extremity. Let's start with the always start with the warm up activities and end with the cool down period or cool down activities. So in warm up period, warm up activities, all the free movements or the free exercise you can do, and even you can perform the exercise with the lightweight ball for upper limbs. Then you can use the elastic tubing, then prone push-ups. Next, throwing motions bilateral, uh, then external and internal rotation against the elastic tubing. So it's a progression of the means it's the sequence pattern for the upper extremities. Then diagonal pattern against the elastic resistance, then unilateral throwing motions of weighted ball, then additional exercise like trunk exercise, holding weighted ball, abdominal call-ups, back extensions, sit-ups, and bilateral throws, long sitting throws, then clap push-ups, prone push-ups from box to flow and back to box. So these are the it's a sample for the plyometric sequence for the upper extremities. So uh, enough for today's lecture. So here we'll end the lecture of plyometry. So thank you friends.